when you guys first came in and you presented the program, I would call it, and you said we were going to see results. We definitely did. And then for a while we did kind of back off from it a little, and the doctor just kind of was like, you know, a little antsy. And then we began to realize, oh wow, we've not getting as many phone calls as we were getting. And then when you came back in and we decided to, you know, get back on board, then we were just thrilled because the phone calls were numerous. The patients, and I found that the quality of the patients were great as well. We were getting tummy tucks, liposuction, breast augmentations, which is what we're looking for. I'm not sure how you guys go about doing that, but we began to get a really good quality, you know, of clients that they were like worthwhile consultations. They weren't just someone coming in because they were interested in Botox per se or Juvederm. All those are good, don't misunderstand me, but I'm just saying we're finding that the lead patients or clients are more tummy tucks, liposuction, you know, breast augmentations, which is what we're looking for. We think the program is fabulous. We've just completed 2 procedures in the last couple of weeks, and that's fantastic. It truly is. Like I said, we're getting, you know, exactly what we're looking for: the tummy tucks, the breast augmentations, the liposuction. You know, we want to do a variety of procedures, don't misunderstand, but those are just fantastic because we've done many other programs in the past that have brought patients into us, but they just, you know, were Botox, Juvederm, things of that sort. We want to do a little bit better than that. What would I say on an average per month? Oh my gosh, I'd have to say it's in the hundreds. It's in the hundreds. What hundreds? 120, 130, maybe even 150. I'm not sure. I haven't actually just stopped and counted, but I know it's in the hundreds because I keep up with it personally myself. And that's because we're just starting this program, and I need to make sure that this is working for us, and it is. I have to stay on top of it. We all have marketing budgets, and when you're going to put money out there for a marketing project, you want to see a return, okay? And that gives us a window to do even more marketing. Right now, as you well know, we decided to take that marketing budget because it went so well to extend it a little bit more with you guys. Normally we would have put ads in magazines, we would have advertised on the radio. We've done several other, you know, advertisement projects, but it's like we decided to put all of our, I want to say, eggs in one basket because we were getting top-notch results from leads.com. Well, we want to be #1 in Houston, and in order to accomplish that, and we need leads, we need clients to come in, and we're hoping someday to outgrow this office and to have a surgical center right here in our office where we can do procedures in office, and this hopefully is going to afford us to do that. That's one of the things we're looking forward to. And I think advertising, and depending on who and what you know, and how you advertise, how you go about it, will put you above the rest. You know, they're good doctors everywhere. They're fantastic plastic surgeons everywhere. And I think a lot of times doctors can sell themselves, but first things first, you have to get the client in here to meet the doctor and see the doctor. And from there, I found by getting clients in from lead, then that person has a friend or 3 or 4 friends, and then word of mouth becomes our advertisement. You know, that person generates 3 to 4 persons, and that has definitely happened with lead. We've gotten some clients in here, and then someone will say, oh, I have some friends that are interested in seeing a plastic surgeon because they've given them the opportunity to meet Dr. Mjadi. He has an awesome bedside manner. You know, he's very impressionable, and the patients just love him. Oh God, we've advertised in magazines, we've been on the radio, we've done billboards, we've actually had ads in the malls, we've done ads in the theater, and I can definitely tell you, I have done every marketing strategy you can imagine. We even had a guy come in that Dr. Mjadi was going to write a book. Well, of course, it got to be a little pricey. But overall, we found the radio is good. It gets your name out there. But the clients tend to call and then they don't show up. Because I think it's a brief second they think, oh, well, that would be great, you know, let me go in and see a plastic surgeon. But then they schedule and they don't show up. That's been our experience as far as the radio advertisement is concerned. The magazine, some's come in, but not a whole lot. Dr. Mjadi was just kind of saying he wanted to be on the first page on Google. When the patients go in and they search for certain search words, like liposuction Houston, tummy tuck Houston, plastic surgeon Houston, etc. And we had tons of guys come in and they promised to keep us on this first page because we feel that patients are going to look on that first page on Google and they're not going to go any further. They're going to look at the first, maybe 3 to 4 doctors, and that's it. It's going to stop. And that's exactly what I asked you. Okay, Brad, where are you different? I mean, how are you going to differentiate from these other guys? You're going to make me some promises. Am I going to see results? But I must say, I've seen results. We've seen the proven results. We're getting the phone calls. We're being asked tons of questions. And the patients are scheduling and they're coming in. So we don't have any complaints at this point. None.